Welcome to this particular module, and here we will be focusing on a very important problem which is cancer. Of course, the course is focused on how to develop electronic systems for cancer diagnosis, but within cancer we will be focusing on two types. One is breast cancer and the second one is oral cancer. Alright. So, there are two different types that we will be focusing on today, and let us see in the following slides what are we going to do or what are we going to learn about these cancers. The focus is how can we develop a system for diagnosing tissue related cancers, and the idea is can we have a system that can understand the change in tissue property as cancer progresses. So, I should say tissue properties because there can be many changes such as electrical changes, such as thermal changes, pH may change, you see the stiffness may change. So, as the cancer progresses, how the tissue properties changes, and if we can measure those properties, then we can develop a system that can start diagnosing a tissue and tell the stage of the cancer. Alright. So, let us see first what exactly is a breast cancer, and if you see the slide shows the statistics and which says that according to the World Health Organization, which is WHO, cancer remains a global health problem, and around 14.1 million new cancer cases were diagnosed in 12, out of which 8.2 million died and 8.2 million is a huge number. And when you understand in cancer particularly breast cancer, then you see that breast cancer continues to be the second largest cause of cancer related female deaths in the world, accounting for 12% amongst all cancer. Huge value, huge problem. Right. So, if you talk about India, then in 16 ICMR, which is Indian Council of Medical Research, estimated that about 14.5 lakh new cancer cases and projected that this is likely to reach nearly 17.3 lakh by 2020. It was also reported that breast cancer constituted an estimation of 1.5 lakh, over 10% of all cancers new cases during 16, marking it number 1 cancer overall. Now, when you talk about cancer and in particular breast cancer, there is a subset of breast cancer which is called triple negative breast cancer, is also short form is TNBC, we can write it down like that, which is an aggressive type of cancer, accounts for about 12% of breast cancer cases. So, you see that like this, if there is a cancer, right, in that breast cancer accounts for 12% of cases of all cancer, right. And when you talk about breast cancer, then about 12% amongst the breast cancer cases, 12% are triple negative breast cancer. Triple negative breast cancer. Now, what is triple negative breast cancer? Okay, we will see that. So, what is the gold standard? Gold standard is the way of diagnosing a disease which is accepted universally. Now, in case of breast cancer, we have to rely on histology. Histology is also sometimes we say immunohistology, immunohistochemistry, IHC, where the tissue is taken out from the breast, from the affected region in the breast or from the diagnosed suspected region in the breast, and we look at different biomarkers. Now, there are several biomarkers. One is called estrogen, another is called prostrogen, another is called HER. So, there are several biomarkers present when a tissue is cancerous. If all three biomarkers are absent, it's called triple negative. So, it is very difficult to understand that the patient is having cancer, but the gold standard says that there is no cancer because all the biomarkers are absent. So, this is even more aggressive type because even the patient is suffering from cancer, we are unable to diagnose the cancer, right. So, 12% of the breast cancer cases falls in triple negative breast cancer. Now, like I said, our idea is to develop a system that can diagnose breast cancer and can potentially understand what is the stage of the breast cancer. So, if you see this table, what you will see, table shows an estimated new cancer cases as per 2015 data, and what you see here is, so this is based on the breast cancer facts and figures from Atlanta American Cancer Society, that there are several cancer like we have seen, like we can see in the cancer type: prostate cancer, lung and bronchus, colon and rectum, urinary bladder, breast, right, lymphoma, thyroid, leukemia, melanoma, kidney, renal and uterine corpus. So, several classes of of cancer, amongst which when you talk about breast cancer, 29% of the women out of 80, 810, 170, which is like 8,10,170 identified are in breast cancer cases, are breast cancer cases, and about 15% of those will die. This is estimated death as per the American Cancer Society. Now, so what exactly we are looking at? We are looking at that this is a very big problem. But when you talk about prostate cancer, then for men it is equally harmful. Anyway, all cancers are danger, but this is what the data shows, that prostate cancer, 26% of the identified cases, 9% dies, or there is estimated death of 9%, right. Anyway, now since if you talk about Indian population, then we will have oral cancer as a cancer that causes a lot of deaths in India. We will talk about oral cancer in subsequent slides. So, this is just about understanding the statistics of the cancer. Now, exactly what do we understand from the overall this slide, this one, right? What do we understand? We understand that worldwide it is estimated more than 1.68 million women were diagnosed, and which means 1 in 8 women, 1 in 8 will be diagnosed with breast cancer during their lifetime. Breast cancer in USA, each year in the USA alone, more than 2,32,714 breast cancer cases were diagnosed, where 43,909 women died. Thus, in the US, for every 5 or 6 women nearly diagnosed with breast cancer, 1 is dying. But when we talk about our country, you see that there were around 1,44,937 new cases of breast cancer in 2015, out of which 70,218 died of breast cancer. That means that for every 2 women newly diagnosed with breast cancer, 1 is dying. A severe problem for our country as well, right. So, what can we do? But before that, let us quickly understand what is a breast anatomy and what are the types of breast cancer. All right. So, if you see the slide, what you see is when you talk about the breast anatomy, the breast consists of duct, right. It consists of lobes, see duct, lobes, right, fat and pectoral muscles. Okay. So, if you talk about types of breast cancer, then what you find is, you find ductal breast cancer which occurs in duct, lobular breast cancer which occurs in lobes, mixed tumor cancer which is in duct as well as lobes, mucinous breast cancer and inflammatory breast cancer. So, the types of breast cancer we can say ductal, lobular, mixed tumor, mucinous and inflammatory. Now, 70% of the cases in cancer is in ductal region, So, let us understand the breast anatomy and what exactly is a breast cancer through this video. First, let me play the breast anatomy and then I will play the breast cancer.
Breast cancer is the most common form of cancer in women today. Knowing more about your own breast anatomy can help you in early cancer detection and prevention. Your breasts are connected to small masses of tissue called lymph nodes by way of lymph vessels. The lymph nodes are responsible for collecting bacteria, cancer cells, and other unhealthy material. You have groups of these lymph nodes under your arms, above your collarbones, and behind your breastbone, as well as in other parts of your body. Each breast is made up of lobes, lobules, and ducts. The lobes consist of smaller lobules that contain groups of tiny milk-producing glands. When a breast is producing milk, it passes through the ducts into the nipple, where it exits the body. Breast cancer most commonly develops in the lobules, glands, and ducts of the breast.
Okay. So, you have seen the breast anatomy video. Now, let me play the breast cancer and stages. You will see different stages of breast cancer here.
The staging of breast cancer refers to the extent of the disease. The cancer stage is based on several factors, including the size of the tumor, if any lymph nodes are involved, if the cancer is invasive or non-invasive, and if the cancer has spread to areas beyond the breast. Stage 0 is considered a non-invasive breast cancer. In this stage, there is no evidence that the cancer cells have spread into neighboring breast tissue beyond the duct or lobule. Stage 1 is considered an early stage of invasive breast cancer. When measured, the tumor is no more than 2 centimeters in diameter, and there is no evidence that the cancer cells have spread beyond the breast. Stage 2 is divided into subcategories of 2A and 2B. Stage 2A is invasive breast cancer, where the tumor is either a maximum of 2 centimeters in diameter and has spread to the lymph nodes under the arm, or the tumor is between 2 and 5 centimeters in diameter but has not spread to any lymph nodes. Stage 2B is a little different in that the tumor is either between 2 and 5 centimeters and has spread to underarm lymph nodes, or the tumor is larger than 5 centimeters but has not spread to the underarm lymph nodes. Stage 3 is considered a locally advanced cancer, and it is also divided into subcategories of 3A, 3B, and 3C. There are 2 main scenarios that can occur with stage 3A breast cancer. One, where the tumor is no larger than 5 centimeters in diameter, but it has spread to underarm lymph nodes that are growing into each other, forming clumps. The cancer may also have spread to the lymph nodes near the breastbone. The second scenario for stage 3A is very similar, with the exception that the tumor is larger than 5 centimeters in diameter and that the underarm lymph nodes are not adhered to one another or other tissues. Unlike the other stages, in stage 3B, the tumor may be any size and has spread into the skin of the breast or chest wall. This stage may also include lumps in the skin of the breast or swelling of the breast. In stage 3C, the tumor may also be of any size, but it has also spread to lymph node areas above or below the clavicle, the chest wall, and/or the skin of the breast. Stage 4 is considered distant metastatic cancer, meaning the cancer has spread to other organs and parts of the body.
Okay. Now, since you know what exactly is the anatomy and the different cancer stages, what is important of early diagnosis? Very interesting slide, and the importance of early diagnosis. Step 1, awareness and assessing care, where awareness of symptom seeking and assessing care. Step 2 will be clinical evaluation, diagnosing and staging, and step 3 will be assess to treatment. So, when you are understanding about awareness, what awareness means? Awareness is there any inflammation in the breast? That can be done using a self test exam, right. Once in a month, it is advised that a women should go for self test and should check any abnormality with the breast, whether it is a inflammation, whether it is a mucus formation, or any abnormal liquid coming out. Also, if there is a stiffer region, it is better to do a self awareness, self testing. And we will see somewhere there that women under 30 and over 30 or under 40 and over 40 are advised to go for mammography and MRI. We will see that slide once in a year or twice in 2 years or in a 1 year. We will see that in the following slides. Let us right now understand the importance. The importance is, as early you diagnose the cancer, you can treat it well. Alright. So, the process is awareness of symptom seeking, assessing care, then followed by accurate clinical diagnosis, followed by diagnosis staging and referral for treatment and accessible high quality treatments. So, if I talk about this early cancer diagnosis, this early cancer diagnosis remains same for oral cancer as well. In any case of cancer, this remains equally important, which is early diagnosis. Now, since we are talking about tissue related cancer, the cancer occurs in a tissue. So, let us also understand what is an oral cancer, and then we will see a device that can measure the change in the tissue properties. Okay. So, oral cancer, if I just give a definition, then the definition would be is also known as mouth cancer and is type of head and neck cancer, and is in any cancerous tissue growth located in the oral cavity, right. So, that is the oral cancer. The symptoms of oral cancer would be early stage symptoms can include persistent red or white patches, or non healing ulcer, progressive swelling or enlargement, unusual surface changes, sudden tooth mobility without apparent cause, unusual oral bleeding, or bleeding from nose and prolonged hoarseness. So, these are some of the early stage symptoms one can identify. What are the diagnosis? The diagnosis is, while a dentist, physician or health professional may suspect a particular lesion is malignant, there is no way to tell by looking alone, since benign and malignant lesions may look identical to the eye. So, when just looking at the lesions, just looking at the image, it is very difficult to understand whether a person is suffering from malignancy or not. So, what is malignancy? You see, benign, malignant, that is cancer, pre-malignant, that is pre-cancer. All right, benign, pre-malignant, malignant. So, it is difficult to know whether just by looking whether a person has a malignant lesions or it is just benign. So, we have to perform further tests. So, the screening cannot help us, the screening can just help us to understand whether a person should go for the histology or not. Now, when you cannot understand just by looking, you have to go for tissue biopsy. Biopsy is where tissue is taken out from the suspected region, and microscopic evaluation of the extracted sample is the only definitive method for determining if the cancerous or precancerous cells are present. All right. So, this is what is all about oral cancer. You can see here there are morphologically altered tissue in which cancer is more likely developed than its apparently normal counterpart. You can very clearly see the different types. It can be leukedema, it can be platelet erythema, it can be leukopelcia, it can be smoker's palate, and it can be erythroplakia. So, it is a leukoplekia, I am sorry. So, you can see a different regions, right. You can see this one, You can see very clear the palette, right. See, so just by looking at this one, it's kind of, it can be understood that that can be pre-cancer lesions, but to make sure it is cancer we have to go for histology. So, there is a very big screening program where the ASHA workers, accredited social health workers, they take the image from the patient's mouth and they send it to the oncologist, which is the head and neck oncologist, to so that a patient can be called, or depending on the image captured, that is screening of the oral cancer patients. We are not interested right now to go into detail about screening of it, but let us quickly see what are the causes of oral cancer. Oral cancer risk factor is of course aging, betel squid chewing, which is your pan. Pan is oral, betel is good, betel leaf is good for health, but betel leaf with sorry, the leaf that we used for the pan is good, but betel nuts, right, and chewing with tobacco is really harmful. Same thing goes for alcohol. We have tobacco chewing, smoking cigarettes, viruses. So if you divide the etiology, you will see that from tobacco to genetic factors, from diet to dental to viral to fungal, there are a lot of causes of oral cancer. And if you want to further understand the cancer statistics, like we understood the breast cancer statistics, what we find that third most frequently occurring cancer in India amongst both men and women. All right. 82% cases of survival in patients with early stage. You see, this is the very important factor. 82% is huge chances of survival if we can determine early stage, if we can diagnose in early stage. 80% of the global oral cancer is accounted in low and middle income countries. Less than 65% of primary centers have access to reliable pathology services, rendering early diagnosis of cancer is a significant challenge. And that is why in this course we will look at a system that can measure the, or that can help to screen the patient quickly. It is a portable microscope for screening cytology cases or cytology slides. Now, biopsy, though is a gold standard for diagnosis, often fails as a screening tool due to invasive nature and the availability of limited expertise. Biopsy is how which you have to take out the tissue from the suspected region, and then you understand different markers, right. Now, understand this thing, that we have taken all this data, the statistics from Globocon 2012, which is the National Institute of Cancer Prevention and Research in India. Now, if you further I go, then incidence of oral cavity, age standardized rate per 100,000 world standard population, and if this is about male all ages, then you can see that less than 3 greater than 6.9 is where we fall, right. Same thing goes for China, and you know less than 3.2, no data available is different, but most of the countries. So, you can see it is a oral cavity cancer is extremely prevalent, is extremely important, and lot of cases are there. So, the point is, can we as an engineer design a diagnosis tool. Now, if you understand from market highlights, this is also important. You see guys, because what is the point of doing a research, what is the point of making a device? If you want to make a device that can send to a market, you have to understand what are the market highlights. So, if you see oral cancer versus other cancer, 30% of oral cancer, all cancer cases are oral, 80,000 plus oral cancer cases every year, 11 to 30% increase in reported incidentally for next 5 years, 25,020 that is 25,020 primary healthcare centers across India. And when you say early stage detection rates, the stages where 1 and 2 is only about 9%, while third is about 83, fourth is about 7%. So, you see most of the, we have to bring this value down, we have to bring this value down to bring this value up, that is the interest. Can we diagnose cancer at early stages? Okay. So, what to do? Now, if you understand quickly the healthcare market, Indian healthcare market, then the healthcare market is among the top 20 in world, valued at USD 3.5 billion. Per capita consumption medical device is lowest as USD 3 compared to developed countries. India medical device industry is under penetrated, which presents a huge opportunity for driving growth. 65% of annual medical equipment is imported as indigenous manufactured devices and are not up to globally recognized standards. So, can we develop a system that can compare with the globalized with the global devices, globally recognized standards. And finally, Indian government under National Health Mission encourages public private partnership models for mass screening and diagnosis programs will boost in vitro diagnostic industries. All right. So, when you understand the healthcare market, you will see that it is a huge opportunity also from our country point of view to develop indigenous devices and to make it as per the globally recognized standards by collaborating with public and private partnership. And the idea again why we are discussing this thing as a part of this course, because what you will do with devices, what you will do with systems, you need to understand what is the role of the system, what is the need of the system, what is the market of the system. All right. This is very important to understand as a part of any course, that what are you going to do when you have a device with you. Is it going further, right? What is a market? Are you going to sell it? If you are going to sell it, is there a market for that, and why you are developing that device. So, everything boils down to question why you want to develop a system for early cancer diagnosis. Aren't there enough systems in market? If yes, why are you working on that? So, the point is we need to understand each and everything from market highlights, the product importance, and how to develop this system. All right. So, combining everything, and of course, for that we need to understand what exactly cancer is, not to really go into depth into the depth where we understand how the cancer forms, but more about what is cancer, what are the changes in the tissues. So, if I go further, then what I will see is screening techniques. So, but before I go for screening techniques, let me complete this module here, and in the next module we will see oral cancer screening techniques, followed by the breast cancer screening, and then we will go for the chip design and manufacturing the system. All right, till then you take care. I will see you in the next module. Just go through it. This is more about information about the two different cancer which we want to understand. One is oral cancer and second is a breast cancer. All right. So, I will see you in the next class. Till then you take care. Bye.